Hi, I'm Dr. Janjua, and I'm very thankful for having this opportunity to introduce myself. I am a practicing facial plastic surgeon in the town of Bedminster, and I'm affiliated with Morristown Medical Center. I got my residency training in otolaryngology, head and neck surgery at Yale University. I was very fortunate because it was a very competitive and excellent program. While I was training, I developed an interest in facial plastic surgery because that's a small part of what we do as an ear, nose, and throat doctor or an otolaryngologist. So I decided to take it further, and I did a fellowship. I participated in a fellowship through American Academy of Facial Plastic and Reconstructive Surgery. And that experience helped me to build up my practice later on in the field of facial plastic surgery. And right now, thank God, 20 years into it, I have a very busy facial plastic surgery practice. And since I just focus on the face, I can continue to hone my skill and become really good at what I do. The biggest challenge for me in all the 20 years of practice has been to learn the psychology of the patient, because facial plastic surgery is a very psychological thing. You think it's just technique, but that's half the battle. The other half is to know exactly what the patient wants, get into their brain, into their mind, and communicate. And that's an art you really can't learn in residency alone or fellowship. You have to keep developing it. And once I felt that I really got a grip on that, that was beautiful, that was very helpful, but I'm still learning. And I'm continuing. My greatest achievement in my mind is having those 3 beautiful daughters that I adore, but that's personal, that's not professional. Let's get to professional. In professional stuff, I recently got a patent, actually last year, on a device that I created and designed that helps stopping nosebleeds, and very appropriate to go along with my rhinoplasty skills. So I'm very proud of having that patent, and I'm in the process of developing that product hopefully in the next year or two. My passion is to reduce human suffering in any way that I can. And when I got into this field, I realized that so many people, they are just miserable, they're not feeling good, and it is something to do with either their nose or their facial deformity that is really killing them, and they feel marginalized. For those patients, changing that deformity into an acceptable result or a great result can literally change their life. I remembered seeing my rhinoplasty patients when I take the cast off somebody who had a hump and was always shy, and they look at the new nose and they start crying. Or some women who always had their hair down and they couldn't really put them up because of being teased for the ears protruding out. And once they were put back, for the first time they could have a bun on the top. And then my skincare cancer patients who were so scared that they are going to have a deformity after the cancer is removed, and I can go in there and repair it and blend it so nicely that nobody is staring at them all the time, and then they don't have to hide. And that reduces their suffering, and that makes me happy, and that's what drives me. I like to learn. That's part of being a doctor. We all learned in school, and it should never stop after your residency. So I keep trying to find new advancements that are really reliable and good. And recently I got trained, not recently, it's been a few years, in a technique called thermi-tight, which has been really remarkable. It gives a result similar to facelift without being very invasive, and that has been a game changer for me, because a lot of patients, they're not ready for facelift, or they're afraid of the word facelift, and for them, having something that is not as invasive but can get results not exactly as much but close to it, it's a big deal. So that has been something very exciting that I've incorporated in my practice, and I'm very busy with it. As a patient coming to me, you can expect a few things: honesty, and honesty, because that's the number one thing. Technique, skills, all those things, yes, there are multiple doctors, thousands of doctors who have that. But I think you got to be honest with the patient, and you got to be down to earth. You don't want to lose your human touch. You want to be able to interact with the patient at a human level, not just like, I'm the doctor, you're the patient, let me do surgery on you. I don't think that really is what we should be doing. It doesn't give the whole experience to the patient. So right from the beginning till the end, I would be honest with my patient, and I would be compassionate with my patient, because when you go to the doctors, no matter what kind of surgery, you're scared. If a doctor holds your hand, trust me, it just builds up your confidence, and you feel like he or she will take care of me, and I will.